Dr. Ryan here, and I want to talk a little bit about disc pain today. One of the things that we focus on here is disc decompression. We've got 2 tables that are specifically made to help with that, and we've been getting awesome results with that over the past couple months. So I want to talk a little bit about what might be the typical symptoms of disc pain and how we treat it here and why it's so common in our society today. So let's start with what kind of pains come with disc pain. So disc pain is responsible for at least more than half of the typical low back and neck pain. As that disc kind of pokes onto the nerve, that's where you can get like a pinched nerve sensation, or if your back is kind of locked up, that's probably a disc issue as well. People get that from kind of leaning forward, so in the low back, shoveling, deadlifting are big ones that we see in the neck after a whiplash accident, like a car accident. That can lead to a disc injury as well, and it doesn't really respond too well to many other modalities, so that's why we use decompression as a specific treatment for it. So let's talk a little bit about why the disc is such a painful thing. Okay, so here we've got a representation of 2 bones of the spine. Okay, so this would be the front side of your body, this would be the back, and then we've got the nerves right here. So in between these 2 bones we've got the disc. And the disc is surrounded by these fibers called the annular fibers that kind of hold the disc in. The disc is kind of like a jelly type of material, a gel, and so it's not a liquid, so it doesn't squirt out and diffuse. When we have a tear in the back of these ligaments, that disc can have an opening to escape out. And so what that looks like is if we have some type of compressive force, that disc will poke out and it'll herniate or bulge, and it'll press on the nerve root. So when it presses on the nerve root, you can either have pain or you can get what we call radicular symptoms, where you might get numbness and tingling or shooting sensation in the hand or down the legs and the feet. So those are big red flags that you've got a disc issue going on, and this type of treatment is made just for you. So the way that works is when we have compression on the spine and that leads to a disc bulge. Why do we have so much chronic compression in our society? One of the reasons that we have so much compression is we sit all the time. So we're sitting for work, we're sitting at home, we're sitting in the car, we're sitting all the time. And that puts the spine in a very straight position and stacks up those discs and just kind of crushes them down. So that'll either lead to a disc herniation or bulge, which can be very painful, or long term that can lead to disc degeneration, which can lead to spinal arthritis. So that's one of the other reasons that we like disc decompression, is because that can increase the height of discs and reduce the risk of future degeneration. So basically what it does is it pulls the spine in 2 different directions, and that'll kind of decompress the middle and allow that disc to kind of slurp back in, reducing pressure on the nerve. So it's a very simple procedure, it's painless, it feels great when you're finished up, and we've been getting great results in about 6 visits on average. With most of our patients, some of them have some serious leg radiculopathy as well, so it's been very effective. So if someone you know has a disc issue, you can give me a call at 224-656-5778. I'd be happy to talk about that and what we could do for you. Thanks.